Madam, please start.
Yes, Jai ma'am.
Yes.
Jai ma'am, please start.
Yes. Good evening, all. Welcome to another episode of Thursday Thrills. And this being month of April, that is autistic month, we have today topic related with autism, empowering autistic voices. The whole month we have seen a very encouraging response from pediatricians all over Maharashtra. We have conducted number of programs, and every program is giving something to pediatricians beyond diagnosis. So we have moved one step ahead of diagnosing autism. And what next after diagnosis? What is the role of pediatrician? How to counsel the parent? On what factors to counsel the parent? All these questions are always there in pediatricians' mind, and pediatricians are very much interested in knowing more about this. So today we are taking this webinar one step ahead beyond diagnosis, and we have experts, Dr. Leena Deshpande Madam, Dr. Archana Kadam Madam, as our experts. And as always, President Dr. Sanjay Pakmode and Secretary Dr. Amol Pawar is always there to support us and encourage us. So let us start today's session. And I request Dr. Sanjay Pakmode, President Maha IP, to give his welcome address.
Namaskar. Good evening. Good evening for this program of today's program, that is Thursday Thrills. And this is specially organized by the Women's Wing. And for the today's program on autism, as we know, on the just 2nd of April, we have celebrated the World Autism Day. And rather, Madam has said for the Autistic Month. So in this month, we are seeing on the WhatsApp group, a lot many activities are conducted in the various branches. So many innovative ideas and so many innovative programs are celebrated every day, and they're posted on the groups. So feeling very satisfied that now the messages are reaching not only for the doctors, the programs are conducted, they are conducted for the parents. So it's a great, the month is really celebrated, because as Madam has said, we are going one step ahead. Just giving a lecture on the Autism Day is not enough, but going in the society and working for the society and giving something society back is also much more important, and that we are doing. On this today's program, I welcome our chief guest, that is Dr. Ramesh Bajania sir. Dr. Bajania sir is a very good friend of mine, and he's Vice President West Zone 2025. So welcome Dr. Ramesh Bajania sir. And today's experts, Leena Deshpande Madam from Navi Mumbai, and Archana Kadam Madam from Pune. Now, just now I told ki Leena Madam is giving every day on the women's group tips, the beautiful tips. The 15 tips I already read, and the 16 tip will be there. And they're so, such good messages are there, very crisp and totally speaking everything. So I think everybody should go through it, and they will definitely help in the practice of Maha IPS. So, and for the today's program, I welcome our dynamic secretary, Dr. Amol, our women wing chairperson, Dr. Jayashri Mushibalkar Madam, who is a moderator, and Dr. Sanjay Deshmukh, who is a convener of Maha IP, Dr. Amol, co-chairperson of women's wing, and Dr. Rishi, Dr. Pankaj, and all the other office bearers of Maha IP and other people who have joined, attendees who have joined today's program. I welcome you all. And I think it is going to be a great thing to hear from both of the experts. And it is going to help us, because whatever we know about the autism today in this program, we are going beyond that. That is the advocacy. The every steps matters, and the problems in the autism, and especially in the schooling, that will be addressed by both the speakers. So I hope everybody will be benefited, those who are attending today's program. Over to you, Jaman.
Thank you, sir, and sincere thank you for giving us opportunity always. And now I request Dr. Amol Pawar, Secretary General Maha IP, for his uh,
Thank you.
welcome address.
Thank you, dear Jaya ma'am. First of all, I welcome our Wage Zone Vice President, my uh, elder brother, always advises on various issues in IIP and in general also. Dr. Ramesh Bajania sir, welcome, respected Bajania sir. I also welcome Dr. Aswini Agrawal sir, Dr. Jitendra Gawane sir, and both the experts, Dr. Leena Deshpande ma'am, then Dr. Archana Kadam ma'am. I have heard them in last 2 3 years on various platforms. Actually, this year we have two eminent developmental pediatricians in our Maharashtra IIP Women Committee. First, Dr. Chairperson, Dr. Jayashree Shivalkar ma'am, and second convener, Dr. Kashmiri Badbade. So, under their guidance, we are celebrating this autism month actually. 2nd April, it happens to be World Autism Awareness Day. But because of them, we have conducted many of the activities online and physically also they are doing, and they are doing with other organizations also. Then next thing, I also welcome our convener, Dr. Sanjay Deshmukh sir, all the executive board members of Maharashtra IIP as well as Central IIP, and all the district office bearers of various branches and all the delegates and all the attendees. We have along with us now. I will just read out the chief guest CV, Dr. Ramesh Bajania sir. Dr. Ramesh Bajania sir is a very fond of environment and child health issues. He was the past chair. He is the past chairperson of this environmental ECH chapter. Actually, it was a group first, and then last year because of many membership, we have increased the membership, and then it has been converted into chapter by Indian Academy of Pediatrics. He is currently vice president of West Zone. Then he's member of Planning Area Committee Environmental Health and Climate Change, IPA, that is Indian Pediatric Association, from 2023 to 25. He's also he was chairperson of ECH group actually at that time from 2021 to 2023. He was secretary of same group from 19 to 21. He was executive member of Gujarat and Diu Daman and from that area of Central IIP for consecutive 3 years in 2022, 23 and 24. Then he was member of IPA, this strategic advisory group on environmental health from 21 to 23. He was delegate. He has attended this conference on international conveying on lead poisoning in India as a delegate. He has represented Indian Academy of Pediatrics in that meeting. He was organizing chairperson of this paid Invicon in 2016, 2021, and 23, which is this group's annual conference. He was organizing secretary of Guj Pedicon in 2010. He was participant of first roundtable meeting on lead poisoning in New Delhi. He has represented IAP in that meeting. He is member of Indian Action Group on lead poisoning. He was joined national coordinator of ILIP module in the year 2024 under the presidency of Dr. G. V. Basavaraja. He was member of ICP, this evaluation and examination in ICP's Indian College of Pediatricians last year. Then he was also member of National Advisory Board, the IPA Care Journal of Central IIP. These messages are popping up and blocking the vision. So he is also national trainer of various of the modules, that is COVIN, Uday, then Point, NTP module, NCCD module, UMP module, Fever. Actually, he has worked a lot for Indian Academy of Pediatrics, and that is why he got elected with maximum votes last year, and he is now currently president of our zone, that is vice president of our veg zone. So I welcome Bajania sir, and sir, please share your views on this occasion.
Thank you so much, Dr. Amol sir, for kind introduction. First of all, let me congratulate you and Sanjay Akmode sir for this flurry of activities, academic activities round the year. I mean, this is phenomenal. And for giving the platform to the youngsters, which was previously unheard of. Excellent activity as far as the celebration of autism for entire month is concerned. So it covers not only community activity, but guidance to the parents also. As you said, yesterday only in one of my parents group, I couldn't post Leena Deshpande ma'am's tip number 16. So two parents, the message that, sir, where is this today's tip? So this is something a phenomenal, I mean, wonderful use of media for the betterment of not only community, parents, but youngsters and postgraduate students. This reminds me of my association with Leena Deshpande ma'am. 5 years back, we organized a wonderful webinar on autism, and due to COVID, it was very well attended. And ma'am, I'll share later on link with Amol sir so that he can share, because it was exclusively related to autism. Now, we daily see so many patients of ADHD, autism, and the all sorts of behavioral disorders. But unfortunately, in our busy OPD, if we simply treat, suppose child has come for URI, then simply treat URI and go to the next patient. But I hope this program will sensitize our practicing pediatricians colleagues and young pediatricians. At least they can sense that there is something wrong in his child. And if that sensitization occurs, then also this program shall go a great way to benefit them. Now, with the advent of so many newborns being discharged at a very early premature age, so in last decade, we have seen even more patients of ADHD and all related behavioral disorders. So youngsters might, in fact, Dr. Nitin Shah sir at that time also said 5 years back that there's a best opportunity for the youngsters to go for such type of branches. And I'm very sure with the eminent faculties like Dr. Leena Deshpande ma'am and Archana Kadam under moderation of Dr. Jayshree Savalkar ma'am, it would be a real academic bonanza. And my sincere congratulations to Team Maharashtra along with Women's Committee for organizing such very useful academic activity, and hope we will continue with it throughout the year. Thank you so much for this opportunity.
Thank you, Ramesh sir. Thank you for your encouraging words for Maharashtra IIP. Over to you, Jam.
Yes, thank you, sir. Your presence is really encouraging for all of us. Before we move ahead, I would just like to have a word from Dr. Sanjay Deshmukh, who is convener of Maha-IIP.
Good evening, all. On behalf of Maha-IIP, we welcome you all, officers of Maha-IIP, Women Committee, Scientific Committee. We are very happy, Women Committee under chairmanship of Dr. Jaya ma'am, Dr. Amol, Dr. Kashmiri. We don't have to worry. They work so hard. Since last 1 month, they are doing a lot of activity on autism. So we are very free person. So we are very fortunate to have the team like a dedicated team. They just do all the work, and we have to just follow what to listen to the great experts on the Maha-IIP platform. So we are thankful to them. I welcome dear Dr. Ramesh Bajania sir. I'm very happy. I was with him as EB last 2 years ago. Amol has nicely described. He has done so much of work, but he's very soft-spoken and always helpful. So welcome to the Maha-IIP platform, sir. We are happy to have Dr. Leena Deshpande ma'am, Dr. Kadam ma'am. They are working so since years in the developmental, and we will be very fortunate to listen to them again on this platform. I welcome all office bearers and I wish all the best to continue this academic in future. Thank you.
Thank you. Thank you so much. This program has been coordinated by Dr. Amok Shahane. She has taken a lot of efforts in organizing everything from speakers to topics. I thank her. As well, I invite her to introduce our first speaker, Dr. Leena Deshpande, and invite her for the talk.
Thank you, Jaya ma'am. Working with all of you infuses enthusiasm automatically in all the other youngsters also. So thank you so much for that kind introduction. I would now like to introduce our first speaker for today, Dr. Leena Deshpande ma'am, a well-known face by all of us who's been practicing developmental pediatrics for more than 25 years now. And madam is the founder of ICANN Child Development Center at Kharghar, Navi Mumbai. Madam has been the coordinator of multiple national TOTs, and she's also been the author of multiple books on behavioral pediatrics. So I'm very happy to invite Dr. Leena Deshpande ma'am, who is going to be talking about advocacy for autism. Every step helps. Welcome, ma'am.
Thank you, Dr. Amog. I'm just going to start with sharing and then, yeah. Okay. So, yeah, thank you, Dr. Amok, for the kind introduction. And I think we go a long way back in Navi Mumbai. Dr. Jaya, I think we met last was February 2020. It was just pre-pandemic, and I had come to Nagpur for a CME. I don't think we have met personally after that. So I think it's high time that we meet personally very soon.
Great to have you here.
Yes, I really thank MahaIP and Women's Wing for this opportunity, and I'm very, very glad to see many familiar names and faces here. Thank you, Dr. Sanjay, Dr. Amol, Dr. Sanjay Deshmukh, Dr. Ramesh Bajania. We know each other for many, many years. Dr. Archana Kadam, we know for years, and of course, Dr. Jitendra Gawane, who's I saw his face somewhere here in the back. So today's topic is a slightly different topic. We're going to talk about advocacy and how every step helps in children anyways, but more so in children with developmental disabilities. And we'll talk today about autism. So I'm going to start by telling you a story about this young couple. This is Mrs. Chakrapani. So there is this young couple, Mr. and Mrs. Chakrapani, and the story starts in 2004 when Mrs. Sangeeta Chakrapani, whom you can see on the screen, she gave birth to quadruplets. So she had one boy and three girls. And of these, the boy Krishna had initial birth issues, but now has then progressed very well. There is one girl, Jayashri, who's doing very well. And there are two girls, other girls, Jayanti and Lakshmi, who both have autism. So I'm just going to put this small TEDx talk, which Mrs. Sangeeta had done. Let's hear what she has to say. It's a very small clip. I hope you can hear the
life. Another wonderful human being who helped us was Dr. Y.K. Amdekar, a brilliant pediatrician, a legendary pediatrician, who saw us through multiple interventions for our children. He today stands by us like a colossus as we work with people with autism and try to teach them life skills and teach them work skills to take their place in society.
So, what was Amdekar sir's role in all this? So it went way beyond the clinic and the clinical diagnosis for this family. It started when the children were around about 3 years of age, with a lot of persuasion and counseling of parents regarding the developmental issues that the children and the girls were facing. And a lot of counseling was needed to seek appropriate help. And as this mother, Sangeeta herself puts it, and we all know this very well, of course, Dr. Ambedkar's greatest gift to his patients is the power of listening and the willingness to explain logically to the family what must be done and why it must be done, and then being there for them through their journey. So this is what happened after the supporting the family, the initial 10 to 12 years after the diagnosis. The Chakrapani couple went to Dr. Ambedkar sir for further guidance because they decided to develop a teaching program which goes beyond academics for adolescents and young adults with autism. So they approached Ambedkar sir for guidance, who simply said to them in his most lovely way, I would like to help you. Please just tell me how I can help. So that's when the Together Foundation was created. Ambedkar sir joined the board of trustees, and over the past 10 years has been mentoring the organization, providing invaluable inputs throughout their journey. Now, isn't this an amazing lesson and inspiration for all of us? Pediatricians have a huge role in the clinic, but also beyond the clinic, a role as an advocate in autism care. Because our influence is expansive. We can pick up the early symptoms of autism. We are the ones who can connect the families to resources. And we are the first people whom the families turn to with their queries, with their hope, with their fears. And this gives us a unique and powerful position, not just as a clinician, but also as an advocate. But for us to advocate for them, we first need to understand what the parents want. What are their dreams for their children? Well, they want the same thing that all parents want for their children. They want their children to have friends. They want their children to learn in school. They want opportunities to participate in different activities. They want their children to be happy and joyful. Now, for this to happen, we have to first start by understanding that a child's development is greatly influenced by the environment that is the child is surrounded with. And most of you might be familiar with this whole child model, where the child is the central focus, and around this child is all these interconnected systems, and the child's development gets affected by all these systems. They're all interconnected. So what are these systems? The immediate parent and the family, the supportive school, the neighbors and the communities, and lastly, the culture, the policies, the governmental policies. All these social health systems influence each other and goes back to influence a child's development. So in terms of advocacy or support, when we talk about, we as clinicians, professional pediatricians can, we can work at any of this or all of these levels. So there is no dearth of work that can be done if we want to do it in a child with autism or any other developmental problem or any other medical problem in a child. So let's start from outwards first. Let us understand what are some of those government policies that we should be aware about, and how can we help our families to understand what is beneficial for them and what are their rights and what are their duties. So the first important thing is, when we talk about advocacy, we can lobby for the laws and regulations that protect the rights of individuals with autism, to make sure that they have access to necessary services and are included in all areas of life. And from the policies point of view, there are three main policies, acts, which are landmark acts in this field. The National Trust Act 1999, the Right to Education 2009, and the Rights of Persons with Disability 2016. We need to be at least aware about these acts. I'm just quickly going to run through these acts so that we are aware when we talk to the parents. The first one, the National Trust Act 1999, basically it provides for protection, shelter, and care for children with autism, cerebral palsy, intellectual disability, and multiple disabilities. And if you go on the National Trust site, there are multiple schemes which are devised for this. All the schemes are there. There is a scheme for daycare for these children. There's a scheme mentioned for residential care, the group home for adults, health insurance, and so on and so forth. All you need to go is to go on the site and click on the links, and you will find a whole lot of resources. Which, if anybody wants to start a daycare, for example, what forms need to be filled, what kind of path to take is very well mentioned. The second one is the Right to Education, which is the 2009 Act, which provides for all children the benefit of free and compulsory primary education. And then this was amended in 2012 to include children with disabilities. But what this act did in 2012, it mandated that children with disabilities should be included in mainstream, but it did not deliberate on what kind of practices or inclusive practices that should be used by school to ensure retention in mainstream. But then comes our latest National Education Policy of 2020, which kind of promotes this barrier-free education and also includes instructions on how to teach children with specific impairments. So things have progressed from the first act onwards, and this is the rights of persons with disabilities is the 2016, which now recognizes 21 types of disabilities. The blindness, the low vision, the intellectual disability, and autism. And I've listed the 21 disabilities there. What it defines a person as to be with benchmark disability is at least the child should have a 40% disability of a specified problem. And then it provides for access to various inclusive education, vocational training, etc. Here's how they measure the disability in autism. The autism spectrum disorder in a child will be diagnosed using either DSM-5 or inclined tools, but the certification is done using this ISA, which is Indian Scales for Autism Assessment. And as you can see here, if the ISA score is less than 70, it is no autism, then mild, moderate, and severe. And then they measure, depending on the ISA score, how much of the disability the child has. So if the child has about 70 score, then it starts with 40% disability, which is the landmark for this act. The good thing and the thing which we all are very happy about is this is the first time in 2024 that the Gazette of India for Disability Certificate mentions the presence of developmental pediatrician, because before this it was not acknowledged anywhere at all. Now, quickly about the UDID project, which was launched by Government of India in 2016. And in 2021, this project has been made mandatory for all states and union territories. This is one of the most important project which has been launched, and it is extremely helpful. We need to be aware about it so we can advocate it to families. It is necessary for accessing all the schemes and provisions by the Government of India. What it does is creates a national database for the persons with disability. Any person with those 21 disabilities can apply. And this is finally going to be the sole document for identification and verification of PWD for availing benefits. This is how it looks. This is the website, swavalambancard.gov.in. And it's a very, very nicely streamlined process. Most of the application can be done online. There's offline availability as well. But when you go online on this website, everything is very easily streamlined. So make sure that you and the patients and the families who come to you are aware about this UDID card, which the government is providing. And this is how it looks like. So there are two cards. One is called P, which is permanent, and the other one is T, which is temporary. This basic information you should, if you are aware, then you are able to advise and counsel the parents in the OPD. P means permanent. So this is given to children or adults more, older than 18 years of age, and younger than 18. It's usually the T or the temporary UDID card is given. On this, you can see that apart from the name, the disability type is mentioned and the percentage of disability is mentioned. Also, this yellow strip means it is a mild, it's about 40% disability will have a yellow, and more than 80% disability will have a blue strip. So this is the way the UDID card looks like. In the temporary one, usually they give a validity of 3 years or 2 years, and that can be renewed when the time comes. The most important the benefit of UDID card is this Niramaya health insurance. Now, we all know that how difficult it is for parents and families and how costly the whole therapy or interventions and OPD charges are. So this Niramaya health insurance, of course, you can go on this site and everything is there. It provides a lot of this reimbursement for parents. You can see the OPD treatment up to 15,000 is reimbursed, dental treatment up to 4,000, and therapy in treatment is also up to about 20,000 per year can be reimbursed through this Niramaya health insurance. So the UDID card and the Niramaya health insurance, they help extremely for the parents and the families in their expenditures on their children for the therapies. And there are all other these benefits also of UDID. For example, in education, they will the parents can, families can ask for classroom support, exam concessions, scholarships, tax benefits are there where exemptions for caregivers is there. Then travel benefits, bus and rail concessions, assistance, wheelchair, priority check-in, all those sort of things are there with the UDID card. So it's one of those, very, very important cards which the parents and families have to know about. It's, various camps can be held at your own clinic to access this UDID card for families who find it very difficult to, go online and do it themselves. So this is one very useful way of helping the parents very practically. And this slide, which I have got from Dr. Ravi Singh, who is in charge of the NIPID. NIPID is National Institute for the Empowerment of Persons with Intellectual Disability. One of the regional centers is in Navi Mumbai. So I'd asked him to give me this, this kind of slide, which has all these scannable and shows all the benefits. You can scan them and you can see what's all benefits and the government and the policies the government has provided for persons with disabilities. So this is a very useful slide, and it will take you to different websites and different links to read and understand. Now let's just come back again to our whole child model. We talked about this, the outer bit, but what is advocacy? It doesn't always mean that there has to be some grand gesture, some big policy, or some national campaign. It can, of course, be that, but it can also mean these daily simple things which truly make a difference in the child's and the family with autism. So advocacy means standing up, speaking out for a cause in whatever way we can. And if we want any change, we don't really need any policy because change begins with people. Every single voice, every little step will help and help the family. This is now our chapter of neurodevelopmental pediatrics is also sending, daily these slogans. And this is one slogan which I really liked. It's not just about making children with autism speak. It's about speaking for them too. So over the last 10 to 15 years, we have all collectively done so much work to improve awareness and education, as we were talking earlier. Do put in the chat box, all the activities you may have done. So it inspires others to carry on these activities as well. So how can we advocate in awareness? We have to increase awareness in public of early symptoms. We have to dispel myths and stereotypes and educate the community of how and what autism is and how it affects different individuals differently. Finding opportunities to do this on various social media, newspaper articles, TV, YouTube, etc., etc. As I said, I mean, we all have been doing this for a very long time, but I remember starting doing this in 2013, about 12 years back. There was hardly any awareness about autism or what this autism is. And this was when we did our first walkathon in Navi Mumbai. And you can see our, with me there was Dr. Upendra was there, Dr. Subhash Rao, and many other Navi Mumbai pediatricians joined us, along with the Navi Mumbai Association, the MGM Hospital, different stakeholders like the local schools, the therapy centers, as well as the parent support group joined us in this walkathon, which had around 800 to 1,000 people who joined us on this Sunday afternoon. It created huge awareness in the local area. It was covered extensively by the local newspapers, so much so that I used to end up getting patients telling me that, who referred you? When I went to the bank person saw my child and thought that there was something wrong and asked me to see a doctor. Or the auto rickshaw person, I've got stories that auto rickshaw person thought that this child doesn't look, something needs to be done for this child, and asked me to see a doctor. So that kind of awareness suddenly increased with a single walkathon in 2013. And over the period, every year we have in the month of April different activities for awareness. And now, obviously, this is not only in Navi Mumbai, but all over our country now, we are doing these activities for awareness of autism spectrum disorders. We did a lot of musical programs. We did street plays. What we also did was we had distributed these posters for pediatricians, outpatient clinics, waiting rooms, which kind of depicted, what are the early symptoms, as you can see here, by 6 months, 10 months, 12 months, what a child should do. And if a parent notices these symptoms, to talk to your doctor. So this kind of a big poster you would find in the local, our Navi Mumbai pediatricians waiting room. And this increased the awareness, where the parents themselves started approaching the pediatrician. So early intervention could be started as soon as possible. We've also done many art and craft exhibitions to show, and these are all done by children with autism spectrum disorder, to show what are the abilities that a child with autism can have. Look at those integrated. I mean, they are just amazing, amazing paintings that these children had shown in this exhibition. So increasing awareness of early symptoms, increasing awareness of the resources. So once you have identified that there are some concerns about a child, it is also very important to advocate and counsel the parents about what are the accurate and helpful resources which are available to them in their area. There is no point in having a very good resource, 10 hours drive, because that is not going to be sustainable by the family. So as far as possible, we want to know what can be given in the local area, and what can, again, now with online resources are also present. But it is important for the pediatrician in charge to advocate for the right intervention, the right center. And it is also important for the pediatrician to help families understand what is evidence-based role, evidence-based therapy, what is the role of various complementary and alternative medicines, and what is unethical and fraud that is happening in this field. It's very, very important that we call out fraud when we see it, because there is so much information on social media that very often desperate parents end up going after these miracle promises that they see, and they will waste their money and the child's crucial developmental time. Now, there are lots of good therapists and good therapy centers. However, like every profession, there are people who claim to be therapists but have no qualification. So let us be aware about these individuals also in our area, because they are the ones who might be putting up big advertisements, huge social marketing. And it is our job to be aware about this in our area and advocate to the families what is the right intervention for them. So whenever you refer a patient, a child or a family to say directly to a therapy center, make sure that you coordinate, make sure that the therapist sends you are aware about what the qualifications are and what how she works, he or she works with the family. It is important, as we say, that to include the parents and advocate for the families to be included in therapy sessions. A lot of times you will get families coming back telling you that the therapy centers are saying that we don't do that. That is not our policy. I think we need to kind of raise our voices against this wrong policy where parents are excluded from therapy sessions, and therapy happens behind closed doors without including the parents. These kind of claims of stem cell, of course, we know that there is no role for stem cell therapy as of now in autism. ICMR has mentioned very clearly about the lack of any scientific evidence. We should also be aware that ICMR says that if any center is offering stem cell therapy for autism as a part of their research, then it is supposed to be free of cost. We should also be aware and advocate the family that if, for example, a child undergoes stem cell therapy for whatever reason, and there are any adverse effects of the stem cell, the child and the family deserves compensation. So all this information, if you have, you will be able to advocate very vocally for your families. And as all of you mentioned, this year we are putting up some autism tip series where we are the Navi Mumbai Association of Pediatrics is every day of the month we'll put up one practical tip which goes to the parents, and these have been widely circulated not only of course in our in our doctors groups, but in therapist group, and there's a lot of healthy discussion which has started in the therapist group as well. So it is a very encouraging thing. Basic counseling parents about that there should be written goals, that the activity should not be just repetitively carried on. You should look for quality over quantity of therapists. All these can be used when you are seeing the child and the family in your OPD for counseling and advocating what is the right kind of way forward. So we'll continue sharing these tips through the month, and if possible, I'm planning to compile them at the end of the month and make it translated in Hindi or Marathi. Also, make sure that there's no piecemeal therapy happening, and with the help of a developmental pediatrician or a pediatrician who's interested in this developmental disabilities, we can fit everything together. A doctor should be in charge of different interventions and should be coordinating what's happening with these interventions. Self-advocacy is important. Encouraging and empowering individuals to speak up for themselves. There's this young lad who is working in a bank, and he talks about how his colleagues are helping him and empowering him in his everyday work. I'm not putting up the video because there's a lot of background noise. And this mother speaks about her child who's now going to be an intern in a company and what are the hurdles that the family is facing. Again, a lot of...
He has completed his MCA and it's final.
Community building is important, advocating that the parents connect with each other, find mutual support, because that will reduce the isolation and foster a sense of belonging. There are various sensory gardens, there are various hangout areas which have now come up in different parts of our country where young adults with autism can mix together, explore and have fun. Coming back to this together story of Chakrapanis, these quadruplets, can you see? They have all grown up now. 2 children with autism, two neurotypical and 2 neurodivergent. Now with these two of them growing up, the Chakrapanis are thinking of starting a residential project for all adults with autism in Hosur. And Ambekar sir continues to support and advocate their cause. And this is their community in Hosur. And a few months back, I was honored when Ambekar sir asked me to join the board of trustees of this organization. So the journey of this foundation will continue. And there are so many organizations, NGOs, foundation in our area, and each of us can do our bit to advocate and support the cause. Our chapter of neurodevelopmental pediatrics, you might be aware about this Developmental Pediatrics Today newsletter, which is a quarterly. We collect all the activities from different zones and compile. And this is all very inspiring to see what all is happening in different parts of our country. We all need to be aware about this ICF framework and the F words which are associated with functioning disability. And the focus has to shift from deficits to strengths. And every time we see a child with developmental disability or autism, we need to think about how best we can make the child function, including the family and friends and the child having fun. So to end, every helping hands count. And with the number of incidents and prevalence of autism increasing, we want all hands on the deck. Now, awareness days like 2nd of April, the World Autism Awareness Days, has always helped a lot in acceptance advocacy throughout the world. But for us, every day can be an awareness and advocacy day. We just have to change the theme depending on the need of the population. Just start wherever you are and the rest will follow. And to end, I'm just going to show you a short clip. Now, this is a short clip from one of my awareness videos where I want to show what the young adults with autism have to say for themselves.
I have autism, that's okay.
We people are not less, just different.
I believe that if there were no such people, no people with autism, the world would not progress further. That is why we say we are different, not less.
I have autism, but I believe it's perfectly okay to be different. We are all imperfectly perfect.
I believe my autism isn't contagious, my spirit is. Thank you.
Thank you very much.
Thank you, Leena ma'am. That was a fantastic session full of positivity, and it really showed us, rays of hope. And like how you said, a pediatrician can do so much more than just refer to a developmental pediatrician when they find something amiss in a normal development. And we were also a part of your walkathon, I think, last to last year, and the vibes we shared with those kids and the joy we felt at the end of it was really very, you can say it was very heartwarming. And I guess we need to have more of these awareness sessions to create more people to get involved in such kind of activities. So moving on to the next speaker. Thank you so much for your time, ma'am.
Thank you.
I just wanted to share. Ma'am has told about this Together Foundation, and just I followed it. And the great thing is they are managing. They are managing this first shop of this assorted chocolate gift bags, and they are preparing this chocolates and all these things. And this has been managed by the people with special needs.
Correct.
So it is very
and just one more thing about that. You know how in special education we are still teaching addition, subtraction, but here they are going out with the GPay. They are teaching directly GPay for these young adults. So it is easy for them to go out to the shop and buy using just the apps.
Great enlightenment, madam.
It is important, whichever way the child can function, it is important to get the child out there in the community.
Great enlightenment and the wonderful job you are doing. Salute to your work.
Thank you.
We are also witnessing the work of Jaya ma'am at Nagpur also. She is also doing the same job over here. So super presentation.
Ramesh sir, any comments? Quick comment.
Yes. In fact, it was so enlightening to know about the rules and the health department's help to the children with special needs. I mean, I am very sure that people didn't know this thing. In fact, ranging from moral support to financial support, etc. So it was truly an enlightening session from Leena ma'am. Second, the advocacy, which you actually you are implementing in your practice. I think it's a food for thought. Those who want to do some good community work, I think you could be a great source of inspiration as well as information for all of them, because these children are real headache to their parents, and in fact they also don't know what to do, because most of the time in our practice, when a child is doing all these sorts of mischiefs, when I asked them casually that, is it the same at home? They said, this, sir, we are so much, fed up of this child. And many times, even simple measure apart from behavioral disorders, like you simply correct the anemia and child is all right. In fact, now environmental factors also, they are coming into being. And lead poisoning is probably one of the very much leading causes. Out of 2 children, they have a high blood lead level. In fact, we are working upon it, and mostly Maharashtra will be taken as a pilot project state. So we'll be working at that time also together, Lina ma'am. Thank you so much for truly different session, and it was very helpful. Thank you.
Thank you, sir. I will be taking questions at the end of the second speaker's talk. So please put your questions in the chat box. So now we'll be progressing to the next talk for today. Another enlightening session by Dr. Archana Kadam, who is a developmental pediatrician practicing at Pune since 2004 at KM and Jangir Hospital. And Madam is interested more in clinical research work in autism spectrum disorder. And she'll be talking about individualizing therapy and schooling in children with ASD. Welcome, ma'am.
Good evening. I'll just share my screen. Is it visible?
Yes, ma'am. Just make it full screen.
Yes. Good evening, everyone. I'd like to initially thank all the organizers of MahaIP for giving me an opportunity to contribute to Autism Awareness Month. And my topic for today is on a common challenge that we face when we are working in clinical practice, which is about individualizing therapy and schooling in children with ASD. Now, we'll first look at some common case scenarios as to how children present to us in our OPDs. So this is a child, a 2-year-old, who was brought in to us by the parents saying that he is not yet using words. He can hear, but because when you say chocolate, he will turn and look around. He tends to play by himself. He is not yet pointing for need, and he is doing what we call hand leading or body to communicate. He's not imitating, not showing or sharing, and he loves to line toys rather than have imitation play. So this is one of the common cases that we would see how children would manifest. Another is this girl, 4-year-old girl whose hearing is normal, who's walked at a normal time, who has issues with feeding, eats smashed food, has issues with oral seeking, bites onto shirt collars, jumps around. She has been on therapy, but she still doesn't use words to communicate. She understands language because if she's hungry, she'll go and bring her tiffin and give it to you. And sometimes there are times when we don't understand what she wants and she'd get frustrated and she would hide bang. This is another manifestation of a child on the spectrum. You also have this, an 11-year-old boy, very, very bright boy, academically doing wonderfully, having A grades in school. And he was brought in to us saying, I don't want to go to school. Now, this is a boy who spoke at a normal time, who's got good grades in school, but his problem was that his problem started at recess time. He didn't have friends. This was a boy who loved collecting information. So he loved space, stars, planets, constellation. And recess break, when he would sit with everybody to eat, he would start talking about all the planets and the rings of Saturn and how they are formed. And all the other children had different things to talk about. They wanted to talk about yesterday night's IPL match. And he would not be able to pick up the cues that the kids are getting bored and all the children would run away. They would tease him, they would bully him. That increased his anxiety, and that was the reason for refusal. Even the teachers, despite his good grades and his academics, if the teacher made a small error writing on the board, he would stand up and say, "You're wrong." And that's when the teacher would scold him, his anxiety would precipitate. So all these 3 cases are our varied manifestation of autism spectrum disorder, which is why we have our new sign of infinity to talk about how every child on the spectrum is unique and has varied abilities. The 3 main areas in which we need to work on, one is communication, second is social, third is sensory, and fourth is behavior. So if we see all our three cases, these are the three areas in which these children would have difficulties. If we look at the areas that we would want to work on in our children with autism, you can have a child who's cognitively able, like case number 3, but he has difficulty in theory of mind, reading that the child in front of me is not interested in planets and changing conversation. He has difficulty in lack of central coherence. What's important at recess time is to be part of the group and to participate and be one of them. He has more interest in his topic and giving out information rather than receiving and listening. He can't read their faces to make out that children are getting bored of him. All our children have difficulties with social communication. Case number 1 has speech delay. Case number 2 has apraxia, where the child has good receptive language but has difficulty expressing speech. And case number 3 has difficulties with social pragmatics, knowing what to say when. Sensory processing difficulties, like case number 2, who was having difficulties with oral sensory issues and putting things in the mouth, and behavior issues, when there are a lot of reasons why children have behaviors. They could be because of change of schedule, communication, anxiety, all of which needs to be analyzed. So if we look at the whole gamut of therapies, these are the therapies that are recommended. Do all our 3 cases need all these therapies? The answer is no. Also, the sort of therapy that a child needs in an individual therapy is varied for every child. Say, for example, if we look at speech therapy, what is our aim for case number 1 and 2? We would want functional communication. So case number 1 would be a child where we would want a play-based program at home to facilitate imitation and to facilitate communication in the form of gestures and words. The sort of therapy approaches that a speech therapist would use would either be a Hanen play-based or an ABA-based. Case number 2 is a child who has been on regular therapy, has feeding, oral sensory issues, and has difficulties in communicating needs. This child understands language, can point to pictures, can follow commands. So this is a child who will benefit from alternative, augmentative communication. Now, this is providing the child with a way of communication which is alternative. Now, this is best for children with verbal apraxia, like case number 2. A lot of times parents ask us, if I teach my child to use picture or iPad, will he speak? The answer is because you're facilitating his ability to communicate. When the child is ready, he may use the word. So now if we look at AAC, AAC is of 3 types. One is PECS. Using a picture card, the child exchanges the picture. You say the word and you give the child the object. That is PECS. We also have electronic communication tools, which I'll talk about, and a sign language, which is Makaton. Now, PECS involves having a card. Now, there are ready-made cards available, but we generally tell our parents to make photos of objects that the child needs and loves at home so that the child can relate to it. And the child is taught to pick up the picture, like here, pick up the picture of sandwich. The child gives it to you. You say the word and you give it to the child. We can also use pictures to help the child for requesting. Even later, we can have the child's entire schedule put up. There are advanced high-tech tools available to facilitate communication for children with apraxia. That is a communication tool called Avas. Here is an iPad where the child is taught to press I am having fun. And you'll be surprised to know if you have a lot of our children who are older, cognitively able, but minimally verbal, can show you the schedule when they come to you and they can say, bored, bye, go home. They can use it to express their feelings and that helps to reduce their frustration. The Case number 3, what sort of speech therapy does that child, that boy need? He needs rules of conversation, social pragmatics. He needs to be taught that when you have a conversation, it is always back and forth. It is reciprocal conversation. He needs to be taught to read cues, if the child is looking away, he may be bored with you. He needs to be taught whole body listening. Look to the person, nod your head, face your body towards that person, see what the person next to you is doing and copy it. He needs to be taught how to join a conversation, and he needs to be taught what is the effect of his behavior on his peers. So that is about speech therapy. Coming to behavior therapy, now behavior therapy intervention is based on principles of learning. Now, the sort of therapy that all our 3 cases need is different. For case number 1, we would need to analyze more in detail to see if there are behavior issues and whether the therapy plan needs to have applied behavior analysis in it. Case number 2 definitely needs behavior intervention. We need to analyze the antecedent behavior and cause. Most of the times, this child's behaviors are because of anxiety at not being understood and communication. So to facilitate the use of AAC, we would need to supplement behavior therapy. Whereas case number 3, who is getting anxiety because he doesn't have friends and he's feeling lonely, would need CBT, that is cognitive behavior therapy, where he's having negative thoughts. I don't want to go to school because I don't have friends. We want to teach him positive thoughts. We want to teach him the correct actions to help him feel better. That is CBT. So if we see, all children don't need all therapies, and the need for therapy evolves with time. Coming to sensory integration. Now, sensory integration is a therapeutic technique where you play with the child and you teach the child to process sensory information better and be more alert and have better functional communication and transit from tasks better. Now, more so, case number 2 would need a proper sensory diet. The sensory diet is taking the child's sensory profile, finding out what areas we need to work on. So this child was oral seeking, the child was proprioceptive seeking, there were a lot of oral sensory issues. So we would need to have a plan as to activities which are given to the child, a 10-minute task which calms him down, which is to be used at transitions maybe 5 to 6 times a day. But every child's sensory diet plan needs to be individualized and is different. Now we'll be talking about inclusion. Now, we've had a wonderful talk by Dr. Leena talking about the rights of children with autism. And inclusion is one of the common challenges that we face for our children. Inclusion needs cooperation between the school, between the parents, the therapists, the doctors, the educators. It's not a one person's job. All of us need to work together. Now, when we talk about integration, which school should a child go? Every child is different. Every child's ability is different. So if the child is cognitively able, he is verbal, the child's sensory issues are less, this child doesn't have comorbid conditions, it's likely that this child can be included as a part of the mainstream. Up to 6 years, we generally tend to say that all children need to have inclusion. Sometimes if the child is older, verbal, has cognitively is not that able, we might have to look at a special school setting. But over the years, we see that integration and inclusion for our children, more schools are opening up to having our children on the spectrum in the class. So these are children who can be part of the class, the mainstream class. They may go out to the resource room for certain academic activities, but be a part of all the other activities like PT, sport, music, to be integrated. So what do we call this? We call this as differentiated teaching, meaning the teacher needs to include this child and have a slight modification in the way she teaches the entire class and have few suggestions or modifications for our child on the spectrum. Let's talk about our strengths of our children on the autism spectrum in the class. They are visually very strong. So if you teach them that the sequence of events, it is PT first, maths first, you give them a timetable, they will follow it better than all neurotypical children. They love routines. If we see over the years, cognitive ability of children on the spectrum have improved, and we have 40% of children who may have normal or even superior intelligence, like case number 3. Some of our children have great academic skills. Some of them read well, though they may have difficulties with comprehension. Some of them are maths wizards. Some of them are good with music. And they're very good with rules. You give them rules, they will never get bored of following them. However, our children also have some difficulties. If there is a change of routine, there was a maths class, but the teacher didn't come. So another teacher came, and I'm not used to something which I don't know. So this is the time where the child may have anxiety and may have a meltdown. 2, following a timetable. They have difficulty with attention to task. They have difficulty in organization. So if the teacher gives a general instruction and says, open the book to page number 49 and start reading, these are too many complicated instructions for this child. So breaking down the instruction, open your history book, find page 49, now check the first paragraph, your turn to read, he will do it. They have sensory issues. The fan moving up, making a noise, the bell ringing. I have a girl who comes to me who's fine in the class, and it started raining, and the rain sound of the raindrops on the window pane created anxiety, and she had a meltdown. So every child, you cannot predict what is going to overwhelm the child in the class. Some of our children may have difficulties, academic difficulties like reading comprehension. You have hyperlexia. At 5 years, the child can read a whole page, but the child may not be able to comprehend the text of it. Some of the children have difficulty in written execution. They can tell you an answer, but when it comes to executing it on paper, they may have difficulty. Some may have dyscalculia. Like our case number 3, they have difficulty in the lunch break because it's unstructured. Everybody doesn't do the same thing. Everybody doesn't eat and go and play the same sport. Somebody goes to the playground, somebody goes to the library, somebody catches me in the corridor and bullies me. I don't know what to do. They have difficulties with conversation, talking about what you like, and remembering what you like is an issue for them. They have difficulties understanding, expressing their feelings and reading your feelings. If the teacher calls up the child and says, Rohan, she is angry, so I've done something, I need to correct it, he may not be able to figure it out. They may have difficulties with rules. They may take language literally. So if the teacher or all of us tell our children, be good in class, good has no meaning. But if you tell him, wait for your turn, put up your hand when you want to answer, keep good hands, keep one hand distance, assembly time, he will follow those rules. So we need to have clear-cut instructions for our children. They have difficulty making friends and keeping them, and they have difficulty adjusting to the rules of the game. Children play cricket and they say, we are bored, let's go on. And they don't understand. They want, if it's cricket, it has to be cricket. So this adjustment and transition may be a difficulty for them. So steps to inclusion. 1, have a correct diagnosis. 2, get your child's profile. Know your child's strengths. What is he good at? What are the areas we need to work on? Get your therapists on board so that we can all come together to create a common plan to help include our children. Now, there are certain strategies that are used. Teach, which is teaching an education for autism and communication handicapped children, which means don't try to change the core features of autism. Try to make your classroom such that learning is feasible for our child. We can have pegs, we can have social stories for our children. We can have modifications in the way we teach. If this child is a visual learner, you give him a big story to read 3 pages with no pictures, he's not going to comprehend. But if you have the same story simplified in the form of pictures, there are videos, he will be able to comprehend and answer better. Methods of evaluation, if we can slightly modify, have more oral assessments, have a quieter place to sit and write the paper, most of our children are able to perform better. So some strategies, one is to put up the child's schedule. This need not be pictures for all children, like our cognitively able case number 3, he would just need a visual sentence written which he can tick off. So he knows lunchtime, he has his rules taught to him in his social skills. So he knows what to do when. We can use visuals which can say quiet, stand up, hands to yourself, and teachers as part of the class can just show him the card rather than say it out so that it doesn't make him anxious to feel that he's doing something wrong. We can use social stories if there is something new happening. Now today they're going to go for a trip to the swimming pool. The child needs to know what is to be done. A social story always is written in first person as though the child has written the story. I'm going to go for a trip. I will travel on the bus. I will stay in my seat. I will do this. And some of the things which we want him to follow, we will say, I will try to. When you write try to, the child will follow it better. Some strategies for teachers are, which we as pediatricians can advocate to tell our parents to share with the teacher. If they know what the child is good at, if we can establish routines for them, if we can use clear-cut language, use clear-cut instructions. We go for assembly, we will keep good hands. You will raise your hand when you want to say something, the child will follow. Some children have anxiety asking when they're called out by name to stand up and answer. So whole class responds, just put up your hand if you think it's yes or no. Give them a choice. These are 10 questions. You can write 5 out of those. Offer them writing alternatives and they tend to comply better. Teach them, give them little help in organizing. So if the timetable can be put up in the compass box on the inside so he knows what's going to happen next. Teach them to their fascinations. If the child likes art, if the child likes history, use that as characters to teach him social skills. Support transition. If the child has to move from the classroom to the playground, or if it's going to be annual day practice, sometimes the child has difficulty. If we can give him a peer buddy, a boy or a girl who'll be with him, who'll just guide him. Don't go there. It's lunchtime. Don't go there. He's waiting to bully you. Come with me. Let's go to the library. Just that little bit of help would go a long way in helping this child socialize better. If the child needs a break, he can ask for it. The break can be a simple thing like giving him a little errand to run. Go take the books to the next class teacher. And the most important is to include our children. So to summarize, autism is a spectrum, manifests in varied ways. Every child is unique. Start early, the child will do better. Therapies need to be individualized and they evolve over time. So a child who may need speech therapy today may need social skills help, may need opportunities to play outside later. Schooling needs individualization and support. I think there is more awareness, but we still need to create more awareness to have our children included as rightful part of society. Why is inclusion necessary for our children? For their psychosocial well-being, for better self-esteem, to help them make better friends, and for equal rights. So I'd like to end by quotes by Temple Grandin. She is one of the famous self-advocates of autism. She is a biological scientist, and she says, why is it necessary to include our children? Because the world needs different kinds of minds to work together. So many inventions and discoveries would not have been feasible if we wouldn't have included our children on the spectrum in mainstream. She also says the most interesting people you'll find are the ones who don't fit into your average cardboard box. Our children on the spectrum make what they need. They'll make their own boxes. So, thank you.
Thank you so much, Madam, for giving such a pictorial presentation, which every pediatrician will, keep in their mind, and which will help them to, call and advise the parents accordingly. Any questions from the audience? Or I would request if Dr. Ramesh sir is there, he can
Yes.
give his comment on the session.
Yeah. Audible?
Yes,
Yes, sir. Audible.
In fact, I must say that Archana ma'am's presentation was simply mesmerizing. In fact, I knew for the first time that there were so many varied manifestations, because a common pediatrician or a student feels that there are some typical symptoms by which we term them as autistic. But this was truly informative. And early intervention is definitely, it helps. So that is, as I said previously, that is the purpose of organizing such type of academic activities, because we, as a general pediatrician, may not be good at counseling them like what developmental pediatricians they can do. But if we identify them at an early stage, then definitely it can help the entire family. And that is also a very correct thing, that every child is unique. So the intervention plan cannot be generalized. They are all customized according to the need of that particular child. And majority of the time, apart from home, child spends time at school. So schools also need that type of education and awareness that every child is different individual, and they should be, school authorities should be involved in such type of activities. So this would be again another area of community work as far as autism is concerned, to involve schools. And of course, advantages of inclusion like psychosocial well-being, what she said, and ultimately the better self-esteem. These children generally they shy away from their friends. So if they are made more, if they make more friends, then definitely it is going to help them. And we can imagine that this is such a complex subject, and how these both speakers made it so easy. Tina ma'am guided us how we can help in form of advocacy. And ma'am has really given enlightening talk. I mean, full marks for it, and I haven't heard such type of presentation previously. Thank you so much. Thank you.
Thank you so much.
Madam, great presentation, and Archana madam. Very
Yes.
different presentation, very different presentations. The individualized therapies, weaknesses, strengths, everything was really awesome. I was means today only one of our developmental pediatrician posted in the group the autism pandemic is going on in the US. The incidence is going to be 1 in 31 children. So with this speed, I understand everybody should know how to treat autism. At least he should know, means at least he should know the salient point. It is not like this in the initial days of practice of us. We used to say, okay, now you go to the developmental therapist and my job is over. It is not like this. Now I should have to shoulder that responsibility by understanding, by learning, by updating myself, so that I will be able to do the justice with the patient as well as his parents and to the society. So amazing. Both you speakers have done a wonderful job. And I think they were the great sessions, great enlightenment today. Thank you. Thank you so much.
So this session is important for pediatricians because there are so many other pathies people coming up and misguiding the parents. There are so many Ayurvedic medication available for speech. There are claims of homeopathic medicine curing autism. So parents do get misguided by this, and the person they trust is definitely pediatrician. So it is very important. Today's session will definitely enlighten and empower pediatrician to deal with the parents. There are two questions in the chat box. One is about the writing problem these children have and mathematical problems in mathematical calculation. Archana madam, can you guide us?
As I said, every child is different. So you may have a child who's cognitively able, but the child may have difficulty getting concepts of math. We would evaluate what help the child needs. You might have simplified strategies used for this child, have more visuals to teach the child. But if the child is in a higher class and is still, there is a lot of anxiety related to math, there are options to, opt out of math and have alternative subjects. But we tend to use this maybe in higher classes rather than doing it early. As far as reading goes, some of our children have difficulties with reading comprehension. So working with a special educator, targeting those areas of weaknesses and having a plan evolved over a period of time helps. If there is definite dysgraphia in writing, some of our children can benefit by having a scribe to write for their exams in higher classes.
Thank you, madam. There's one question for Dr. Leena, madam. There are some misconceptions about autism or some myths. So, can you just narrate few?
Yeah, so what myths have you heard of? Then I can correct them. Can I just answer the previous question before with that? When
Yeah,
you talk
there are
about
some
academics,
misconceptions about autism, which maybe 2 or 3 which you commonly see with the parents.
Yeah. So can I just answer the first question a little bit? I just wanted to make a point.
Yes,
When
definitely.
we talk about academics in autism spectrum disorder or any developmental disability, I think we need to be talking about useful academics. Okay, because I have children who are doing extremely well. They got 90%, 80% in their 10th standard, but they get 90 marks out of 100 in their maths. But you give them a 100 rupee note and ask them to go buy 30 rupees bread, they will not be able to do that. So I think it's very important to, along with the academics, it is important that the functional academics, the useful academics needs to be taught for these children. Misconceptions, there are many, right? Parenting causes autism. No, it doesn't. Autism is largely genetic difficulty disorder or birth issues might be present. Misconceptions that vaccines can cause or might cause autism. It's a misconception. I can expand on any of these, but I don't think we have the time for that. It's a misconception that TV screen time causes autism. So there is no such term called this virtual autism term, which has been is going around is not autism because it is one of the differential diagnoses. Certainly, screen time will decrease the social interaction, will cause problems with attention, will cause problems with communication. But you stop the screen time, you start stimulating the child starts responding very quickly. So there is no such this term called virtual autism, something we should not be really using. It's been coined by some psychologists abroad, but it gives a wrong impression that to the parents that it is going to be all fine if the screen time is stopped. Of course, in some children, if screen has worsened the communication and attention, making those corrections will help the child progress. Any other ones? Which any other misconceptions you've heard, which I can.
One question is there that how to improve concentration in 10-year-old.
Archana, you want to take that?
Every child is different. So one, we would need to analyze. A lot of times when parents come up and say that the child has an issue with concentration, we need to see how the child is in class. We need to see the child in more than one setting to see whether the attention is really an issue and have an individual plan, have an assessment and an evaluation and see how we can help in terms of providing modifications, parent handling and maybe medication if really indicated.
One question is there, I think both of you can give your inputs. Any dietary role of diet or dietary restrictions are there?
No, so there is no blanket diet which we use. If there are any clinical symptoms, if there is any gut issues, constipation, intolerance to certain foods, certainly we can look at the dietary, but a blanket or a blank taking out nutrients from the diet will take the child down the wrong path. So there is, but certainly, there are some parents do mention that if the child eats very sweet things, then the child becomes hyperactive. If you've seen that association, let's stop that. So the parents are best to judge that. We always talk about things like fizzy drinks or artificial colors, artificial flavors. This should always be restricted in all children, and definitely in children with autism spectrum. So, but
thank you for clearing this, because the parents read on internet about this diet, that diet, gluten-free diet, and on their own also they start practicing it. So I think this is very important to have pediatrician opinion.
Putting on restricted diets will worsen the nutrition of the child and cause more harm than help.
Yes, yes, and very frequently asked question: role of nutrient supplements in these neurodiverse children.
Yeah. So if there are feeding issues, then if there are nutritional deficiencies, certainly, but otherwise shooting in the dark by giving, nutritional supplements will only help the brain tonics or the brain supplements will probably help the chemist more than the child.
Because autism is, you can't pinpoint the cause. It's epigenetic. So you wouldn't be able to pinpoint as to what specific supplement would help. But what we would say is a healthy homemade diet with less sugar, less preservatives is what we would recommend.
Yeah, that for any child.
So unless there's specific gut issue, like any other child, a child with autism spectrum can also have celiac or gluten sensitivity. If that is so, prove it and get a proper dietitian involved and do it properly. But
So
otherwise,
again,
shooting in the dark.
Responsibility of a pediatrician to keep him updated and guide the parents, because as we have seen, there are many others who misguide the parents. So I think this session was very important, eye opener for pediatricians, and we all can come together to update ourselves, empower ourselves, and guide parents accordingly. So thank you so much. And before we go for vote of thanks, I would personally like to thank Dr. Amuk Shane for taking initiative and coordinating this session. And I invite her for a vote of thanks.
Thank you, ma'am. Thank you so much. First of all, I would like to thank both of the esteemed, experienced and fantastic speakers for their enriching talks on these topics of advocacy in autism as well as individualizing therapies for autistic children. And this session enlightened in a nutshell about the various government policies required for autistic children, especially UDI ID cards, which we weren't aware of, and the benefits these children are entitled to in India, and it is very imperative for them to lead a comfortable existence in society. It stressed upon the importance of evidence-based therapies for children and to guide parents about the unethical practices in the community. Madam has also highlighted about the integration of autistic children in mainstream schooling and through various strategies and therapies to highlight their strengths and enhance their learning experience. It was explained beautifully by Archana ma'am. I would also like to thank the chief guest for today, Dr. Ramesh Bajania sir, for a patient hearing till the end and for giving us his valuable inputs. And I would like to definitely thank MahaIP platform, Dr. Sanjay Pakmode sir, Amol sir, and Deshmukh sir, and Jaya ma'am, obviously, for all the inspiration and encouragement they give for such academic, you can say, feats which we have every week. And I would also like to just end today's session in a nutshell by quoting a quote which says that it takes a village to raise a child, but it takes a child with autism to raise the consciousness of the village. So a little extra care, a little extra love, and little extra understanding can go a long way in helping these children bloom at their own pace and make this world a beautiful place for them to live in. So thanks for the session for today, and let's include these children in the mainstream life. And thank you everybody for a patient hearing.
Thank you to all participants who have
Dr. Amok madam.
Yes, sir.
We should thank Dr. Pusate sir, our MMC observer.
NMC observer, sir. Yes.
Thank you, Dr. Pusate, sir.
Forgot is mention his
No,
name.
no, not Pusake. Dr.
Pusa-
Pustake, Vaibhav Pustake.
Pustake.
Dr. Vaibhav Pustake,
Sorry.
sir. Thank you, sir.
Thank you, Pustake,
Yes,
sir.
actually, he was ill, so he told he will join. He will take screenshot
Okay.
and then he will.
Okay.
He
Can
will
we have
not,
a regards
he
to
can't
him?
attend actually.
MMC ऑब्झर्व्हरला अमोलला बरोबर माहिती असतं तो he never forgets his name.
Yeah, today I forgot. Yes. I forgot to mention at the beginning actually. He is Dr. Vaibhav Pustake. He is past Secretary General of Maharashtra IIP and senior pediatrician from Pimpalgaon, the great city of India.
Okay. Thank you, everybody.
Thank you, Ramesh sir. Thank you, Sanjay
Thank
sir.
you.
Leela ma'am.
Thank you so much for
Thank
this.
you,
Archana
Ramesh sir.
ma'am.
Thank you,
Good
Archana
night,
ma'am,
everyone.
Leena madam.
Ramesh
Thank
sir,
you, Jaya
Sir,
madam.
madam,
Thank you,
Sanjay sir.
Amol.
Thank you.
Wonderful
Jai Shri Ram,
coordination.
ma'am.
Thank you, Amol.
Thank you,
Thank you,
sir.
Sanjay.
Thank you, Leena ma'am, Archana
you,
ma'am.
Jaya
And
ma'am.
all the attendees.
Sanjay
who
Patmode, sir.
make it
Thank
till
you.
the end.
Thank you.
Aris sir, thank you. Good night,
Thank you,
sir.
Jaya ma'am.
Thank you for
very much.
attending.